Mr. Admeji. All right. Professor Kudus, you are now host, and I'll be leaving the meeting now. Thank you very much. And Prof, good day, ma.
Good day. How are you? Thank you.
Very well, ma. Yes, ma. Good to hear your voice.
Thank you. Sure.
Okay, I can start. Okay. Okay. Good afternoon, everyone, and good morning. Sorry, my phone is recording. Okay. Hello, everyone. My name is Mary Obion. Good morning, good afternoon, depending on wherever you are. And since it's a virtual class, I am happy to be here today. It is a great pleasure to be here and share ideas and learn new things, and also unlearn some things that we thought it is the thing. Thank you, Prof, for giving me the opportunity to be here also. Thanks, Dr. Kudus. You've been very supportive. So I'm assuming I'll just start, right? Just head on. Okay. So you can start my slide, please. I would also like you to please give me a sharing right so we could do the survey when I'm ready very soon. But please start with my slide. Thank you. Okay. Everyone, once again, welcome to today's session. So this is a great initiative. I actually went through the different topics that you've been undertaking and that you will still take. And I think it is really a great one. If you pay attention, you can actually undertake many projects. You can undertake any kind of health research. You can manage large scale or small scale research. These are the basics that I think you should just pay attention to. And I'm happy to be here to also cover this particular topic. So today we'll be talking on study design in health research. Next slide, please. Thank you. So I tried to make it structured so that we are sure that we're covering what we should cover. So I'll be going through 4 key areas, and so these are the objectives that are guiding my discussion today. Understanding the importance of research designs, identifying different types of research design, grasp the fundamentals of the quantitative and qualitative research design, and also learn about mixed method research design and its applications. Next slide, please. Okay, and please go back to the previous slide. Thank you. So you're going to permit me to, I'm going to share an information with us. Everyone, please, I'm going to drop it in the chat now. Please go to slido.com and key in this code. Let me know once you are in. Once you are in, just type in, so that I could start. Okay. Please indicate in the chat that you are in so that I will know that we are all in. Go to slido.com and then punch in that code. Thank you, everyone. No, it's Slido. Slido.com. Yes, the code is 3073287. Okay. Updates, are we in? Can just do thumbs up. Okay. Okay. I've only seen 5. We are about 17. Okay, just do thumbs up on him. Anyone is fine. Okay, I'm counting about 6, 7. One, 2, 3, 4, 5, 6, 7, 8. Just 8 of us. 9, 10. I need more hands up, please. Just to be sure that we're all on the same page. And then and also to make the class very interactive and engaging. So I need everyone to be in. Okay. So I'm going to make the first quiz go live now. Okay. Only 3 people have answered the first. Okay, 5 have answered the first question. We have 8 seconds more. Be fast punching your answer. 4 seconds and it's going and it's going and it's going and it's gone. Only 10 people answered. We should be more. So I'm not going to tell you the answers. I'm going to make the next question go live. Are you ready? Okay, go. You have 50 seconds more. Fifteen have answered. We should be more. And it's going. We are 16 now. Okay. 10 seconds more. Going, gone. All right. Okay, let's go. $50 seconds more. We have 3 more questions. I try to make sure that I cover everything here. Just 3 more questions and we are good. Please don't go to ChatGPT. Please don't go to Google. We are here to learn. Okay. 10 seconds more. It's going. It's going. And gone. Okay. Now question 4. Starting now. Okay. Question 5. Four more seconds. 65 not answered. Or 4. So for this, I think some people were thinking which is it. So they didn't. Okay, you are excused. But this last one, please, everybody must ensure the punching and answer. And the last question goes live. Please don't go to Google. Don't go to ChatGPT. Okay. Thank you, everyone. Thank you, everyone. Please let me have the slide view, the presentation view, please. Or maybe because I'm seeing myself, so I'm feeling I'm not seeing everything. Next slide, please. Thank you. So, welcome once again. I intentionally will not post the response now, so you don't screenshot. I do that a lot. I screenshot things a lot. So that at the end of the class, when we are taking it, I should expect to have 100% of the correct answer. However, thank you for trying that. Okay, so what is research? I know that you've done, I saw ethics in research. Why do you need to conduct research? Designing your research question, making your objective smart. I've seen some of those things. So this is the next. However, I will just go through. So the research process will just walk us through some brief intro or brief background. I'll also slightly touch some of the things that you already did in class. So the research process, please let's all mute. Thank you. So the research process helps generate evidence. We have come to the age now that we can't afford to make a mistake. It is not excusable. It is not allowed. There is nothing about 20% chance of making mistake or 10% chance. No. And it doesn't matter whether you're in Nigeria or you're in Britain or you're in Canada or you're in New Zealand. It is the same standard. A quality study generates evidence. And every decision today is called informed decision. And you need evidence to make informed decision. And our work, our job as researchers is to stay at the back end, gather the data, do the analysis, get the figures, interpret it into understandable context for your administrator, for your chancellor, for your provost, for your minister of health, for different audiences, even for your colleagues. So you need to get this evidence so when you're talking, you understand what you say. And then you can say 10% of this risk is not just about 10%. It actually amounts to millions of people. And this is significant. So before you could say something significant or something very important, you need to get the evidence from rigorous study. To promote health outcomes, it's important to generate evidence. Research studies with robust methods needs to adopt appropriate study designs. Appropriate study designs. I want to go to Port Harcourt. I want to go to South Africa. Mind you, I can get to South Africa by road. I can get to South Africa by boat. However, I choose to fly. Why am I opting for that mode of transportation? In research, I want to know the prevalence of obesity among under 5. You're like, no, it's not possible. Oh, it's possible. Okay, what are the determinants? Is it based on the social status of the parents? Or is it based on the economic empowerment of the mother? Is it based on the education of the mother, of the father, or both? Or is it based on the environment where they live? You see, to say I want to understand factors that determine obesity among the 5, I need to first outline why under 5. Why not 12 to 16? Why not among adults? Now we're having a lot of male having pot belly. Why not? Or how am I even defining obesity? How am I even sure this is the standard definition? Why the study population? How am I collecting the data? Am I going to call a 4-year-old to interview? Or am I going to ask the mother? Am I going to ask the father? Why the mother, why the father? How am I going to ask the question? What questions am I going to ask precisely? Then, or do I even need to go and live in that community to understand whether there are underlying factors that I couldn't capture that are actually explaining why we're having this factor, this risk, or this disease, or why this particular population experience a higher burden compared to other group, compared to other population group. Your research design helps you to think through this. It is like a guiding map. Next slide, please. So, some of you are already seeing the response now to the question I asked. Appropriate study design is a cyst of just the research process. In the reference, I'm going to mention particular, actually, I think I have it. I'll try to tap it in. If you really want to go into research, you could try to get this book. It's called Health Research Methods, A Canadian Perspective. Not that it's really Canadian content, but because it's just like, public health is highly regulated in this area, in this country. So, sorry, I'm currently here for a program. So that is why I'm like speaking like this. I'm sorry. So that is why we have Canada perspective, but everything in it covers steps in research back to back. Everything you need to know about research. And if you want more, then you can get more. It will give you resources, to reach, to use. So for research process, you know your topic, you conduct literature search to identify the problem, to know the prevalence, to develop your question, to generate your hypotheses, and then to choose your appropriate study design. Next slide, please. I'm not going to go to the others. Next slide, please. Thank you. What is a research design? Research design is a crucial part of the research process. It provides a structured plan to collect, to analyze, and interpret your data. A well-planned research design ensures the validity, reliability, and generalizability of a study findings. If I collect data from 3,000 pregnant women, is that sufficient for me to say that there is a burden of malaria among this group? Maybe, based on literature, but in this community, is that population enough? What are the things, what is the design that I will use? What are the methods that I will use that could make me say that, 3,000 or even 500, I can generalize, not just in Osun State. I can use this also to speak or to advocate for pregnant women in Kano State, in Anambra. So all this depends on your research design. Next slide, please. Why is research design very important? I already provided a brief into this. I mentioned earlier, it guides the entire research process. It is your guiding map that gets you to your destination. And what is the destination we are talking about? I'm not talking of Kano. I'm not talking of Lagere. I'm not talking of Abuja. I'm not talking of Ikeja. I'm talking of achieving your research aim. And maybe that is not even the end. Maybe this is even your baseline. And you actually still want to develop an initiative. You want to develop an intervention to address this burden. So that means that from the start of this first phase, of this baseline, you already have in place what would help you to achieve phase 1, which is this first phase, collecting data. Phase 2, analyzing, interpreting. Phase 3, developing the health intervention. Phase 4, implementing the health intervention. Phase 5, appraising the health intervention, evaluating the health intervention. And 6, your policy recommendations, talking to the funders, advocacy, media out, campaigns, or whatever method you choose. So having your research design helps you, it gives you the map, it gives you the steps from step 1 to the end, to your destination. It helps to align research questions with methodologies. For example, I want to understand use some other contraceptives among newly wedded couple. It's possible, right? Gone are the days that will say, now evidence is showing that for these newer generations, they know about having babies. They still want to settle, they want to enjoy. There's so many theories out there. There's so many literature out there that's not talking about delayed fertility. No, not delayed fertility, delayed reproduction now. Delayed childbearing, intentionally delaying childbearing. So I want to know uptake of modern contraceptives. Which one are they using? Why are they using this method? That is question one. Am I going to use questionnaire for that method to answer that question specifically? Another question could be, what are the thoughts of newly-wedded couple on modern contraceptives? How am I going to capture that in numeric value? Or am I going to say, you know what? I can't get that in 2 + 2. I need to probe. So I'm going to ask, what are your thoughts on modern contraceptives? I think they are good. Okay, why do you say they are good? Because it keeps me safe. It's comfortable. Could you tell me the particular one you use? You see, I could probe to get more information, to have in-depth understanding of the phenomena. For this particular question that I want to address, of the object I want to address, my research design will help me to know, for this one, questionnaire might not be ideal. Survey design might not be ideal. I could use interview. I could use focus group, or I could use another method. Or what even makes me think that condom is the best method or is even safe? Or has it been linked to a problem? Has it been, you see, maybe then I have to do a more advanced research, like clinical trial, So your research design helps you to design method, to come up with methods that would answer your research question. Next slide, please. And third, research design ensures an efficient use of resources and ethical considerations. This is very important. The respect, privacy, confidentiality, respecting the right of your participants, of your respondents. There are some methods that for some question, for some study, they'll say, no, this is not ethical. For example, am I going to expose a group of people to a disease? Or am I going to inject them with something that would make them prone to a health problem because I want to understand, because I want to examine the efficacy of a particular drug? That is not ethical. What I want to know is the efficacy of a particular drug, yes. But my method, is that ethical? No. So what things can I do? What other methods can I use to still answer my question? Research design helps you to know that and to do the right thing. Next slide, please. Thank you. So in today's class, I would cover briefly 3 research design methods. That's the quantitative research, the qualitative research, and mixed method research. I'd like to drop it here that every day we are having new branches. We are having new methods that some of you are like, oh, what does this mean? Cluster survey. Okay. Cluster survey. I start different from adopting cluster sampling and then distributing your questionnaire, right? So the thing is that they are all just branching out. People are coming with different theories, but the basics we'll cover today, like the commonest method or approaches and the common categories will be covered. I'll try to go through them. Then please read more and improve your skills on your knowledge on these things. Quantitative research is a systematic investigation that primarily focuses on quantifying associations, relationships, and other phenomena. It is systematic. It is methodological. It is methodical. It is step by step. You can't skip step 2 and go to step 4. I won't print my questionnaire or write my questions without being sure that my objectives are clearly stated. Are they measurable? Are they specific? Is it clear? Is it time-bound? So I'm not going to skip one to go to another one. I'm not going to start talking analysis when I've not even outlined my variables. So I want to conduct a cross-sectional study. Okay. I'm going to analyze using chi-square. Okay. My inquisitive me, I'm thinking, okay, why chi-square? What are your variables? How are you measuring your variables? Is it dichotomous, which is your dependence, which is your outcome, which is independence planetary? So do we have those we are going to control for? So I'm also think that chi-square is the best thing to use it. You see, that is the little me. Because I'm thinking, no, before you get there, I need to have this. As I'm having my question, I'm having this is causing this. I'm knowing, okay, this is the method to answer this question. Okay. So these are the questions that I will have that will capture or measure this particular variable, this particular outcome. Okay. So for example, use some other contraceptives. And I'm having question. So how many times do you use modern contraceptives? That has not answered my question. That has not answered. So if I want to measure, that is not the most appropriate. But if I ask, do you use modern contraceptive? Yes or no? Which methods do you use? That I'm using to check whether the person actually know what modern is. Then how many times? I could put the three together into one to say, I'm using these three questions to measure use of modern contraceptives. Or I could say, I'm only using one question. Do you use? You see, I already know what I want to measure. And it's systematic. I have the methods. I have the process in place. Quantitative is numerical. It's 2 plus 2, 1 plus 1. It's numbers. It's close-ended. You're not asking, so the common one is, what's your age? How old are you? And people are writing 20, 22, 24. Okay, it's for 10 students, maybe. For 30, maybe. But come on, for 400, I'm not going to do that. Yes, I know I have my starter, but I could divert that time and energy to something else. I'm going to put them in age grouping. That's why we have age grouping, standard age grouping, 20 to 24, 10 to 14, 15 to 19. Pick anyone. So you see what I'm saying? I have that. So I could say age 15 to 19 is 1. 20 to 24 is 2. It's coded as 2. So when I'm doing my analysis, wherever I see 2 and this, I understand, oh, people in this age group 2024 coded as 2 have higher prevalence of this. Quantitative is numerical. And whenever you hear hypotheses, reliability, or like I actually mentioned, generalizing to a larger population, just know it is quantitative research. Next slide, please. Why quantitative research? Why is it important? In public health, why do we have to adopt this particular research design? For objectivity and precision, I've mentioned this, I've also explained it, provided some context. It gives a structured way to measure and analyze variables. It is clear. There is no back and forth. It's you're either 15 to 19 or you're 20 to 24. You cannot be 1.5 here. You see, it's either a yes or no. And my no is 0, my yes is 1. You see, so if I see yes, is yes. If I see is 1, if I see no, is 0. There's nothing like, oh, it's no, and theta after no, it's clear, it's well defined. Generalizability. It uses large and representative samples. Maybe you still talk about, maybe you still get there. Sampling is also very key. Sampling is very important. I've also mentioned the method you adopt, your sampling method, your sampling design also helps you, it helps you to know whether this is generalizable. For example, I'm doing focus group discussion among 200 participants or 400 participants. Okay, that sounds large, but it's qualitative. I mentioned focus group. Then the next question would be, how come you have me? I'm thinking that is too large. Wow. How do you deal with all those teams? How do you deal with the coding? Because I already know that 400 definitely going to have them in groups, group of 10 or group of 12, So group of 10, you're talking of 40 different focus groups. That is large. But even though 400 is large number, it is not representative. It only applies to the group that you are dealing with. It only answers that question for that particular subgroup, for that particular community, to provide more information about that within that population. You can't say this is now represents, or this also speaks to what happens in another place. It can provide the context. Then it cannot go to say, let's even check, are they undergoing the same thing? Do we have the same factors that are responsible, the same determinant or not? Is a different thing entirely. Next slide, please. Why quantitative research, statistical analysis, use of statistical methods enable researchers to identify patterns, relationships, and causality between variables. Very soon we're going to know some designs that can explain causality and some that does not only explains relationship association. An increase in this or an exposure to this would lead to, this outcome. Reduce the risk of this outcome, reduce the burden, or why some would be, if you experience this or exposed to this intervention or exposed to this risk, this will happen. That is, that's causality. So the analysis method, your design will inform your analysis method. Your analysis method will explain what you are bringing out. Are you just identifying the pattern, skewed or not? Are you just to explain relationship or association, or you want to go advanced and explain the causality? Quantitative research provides evidence-based practice, helps evidence-based practice. It provides evidence to support or to refute hypothesis, theories, or interventions. You know what? This has been not very well. However, we found is actually not working. Why are people not so why we have outbreak of cholera in a place, and then we know we have the salt sugar solution, but in this community, despite providing the, I think we call it ORS, sorry, permit me, it's been long, they are not using it. Why? And we already have, no, you must use this. This is one that explains this. Quantitative research will help you to identify this is the pattern, and this is what explains this association or this pattern that you are seeing. Or it's actually different. It's not actually related at all. So it will help you to support or to refute hypothesis. Next slide. And lastly, you can compare different groups, conditions, interventions at the same time. Evaluate the effectiveness, efficiency at the same time. And we can conduct a study and recruit participants from Lagos, from Rivers. In fact, it could even be a multi-country study in Nigeria, in Kenya, in Togo at the same time, right? Our population group defined the same, and then we can compare. An example of this is the demographic health surveys. It's the same standard, measuring the variables, the outcome, whatever. All the variables, they are the same. The factors that are hundreds and hundreds of variables, or social background, social demographic, or economic factors, so many things. Is the same definition given to it. So you can pick out some data and explain and compare that in Kenya, in Ghana, in Nigeria, this is what causes this association. Next slide, please. Thank you. So now let's go to quantitative research designs. I try to, again, like I mentioned, I'll quickly cover some of the basic common research designs. However, they're classified into two main categories: non-experimental and experimental research designs. Next slide. For the non-experimental research design, it observes and analyzes variables as they naturally occur in their natural setting. And it's often baselines. We can't have a clinical trial or RCT as a baseline. No, that's usually the golden standard. It's like the end, right? We want to cause this, we want to do this. So non-experimental research designs are often used to generate evidence, preliminary data that can now be, scaled up or probe further. Why is it important? It enables study of phenomena in real-world settings. It explores and describes issues. You can say you want to find out association between age of education status of mother and educational outcomes of children. You see, that could be a new study. Maybe it's been done before, but you know what? Now you want to go to a different setting entirely to go and conduct that study. So something new, or just to advance existing knowledge. Also, it's important because of the practicality and ethical compliance. I've explained this before. Next slide. I'm going to mention 5 quantitative research designs here. I'm coming. I want to pull up my own. Okay. I have as there are 5 that I'm mentioning here. I have the survey research design. I have the descriptive research design. I have the correlational research design, longitudinal research design, and cross-sectional research design. So the first we're talking about is survey research design. It involves collecting data through questionnaires or interviews administered to a sample of participants. The design allows researchers to gather data on a wide range of variables, can be collected in various settings, such as online surveys. You can mail the survey questionnaire in. We have chat surveys now. And for those that want to, maybe you want to reach out to Amazon, and it may not be convenient to call in from Nigeria because of the cost, but you could just go to the page and you're going to see something chat, ready to talk, or yeah, someone is available. Then now that many of these things are now powered, are now AI powered, it makes it easy. And so they're asking questions: what's your name? What did you buy? What's the issue? How can I help you? And after that, they could even ask you some more questions, another question, maybe to get more about your experience, of their response to you, how they attended to you, or even your provide feedback on particular products. You see, these are short surveys. They get the information, and it's also valid. It's been approved as a means to generate quality data. And we have phone interviews or face-to-face interactions. When we are face-to-face, we are talking of the normal Grandmaster style of distributing questionnaire. And here I would just like to quickly mention, we have different types. We have interview administered. That is, I'm asking a question, I'm completing it for you. Or respondent administered. The respondents or my participants collect the questionnaire, fill it in, and I pick up later. Both have even advantage, have a disadvantage. The commonest one is that people could lie. Just a male can say, I'm female. Where in Nigeria, I'm not talking about other genders. In Nigeria, male, female for now. And so a male, this male, but it's pretty female. There's no way you know. But female, yes, my colleague came and filled it. Especially, let's say there's some that if you have 3 children, you collect this gift. They can write, even someone that's yet to have a baby can say, I have 3 kids, can say I have 2. But if I'm the one completing it myself, at least I will reduce the errors, and also limit the biases. So provided for each of the design, I try to provide just a single line on the purpose, just provide more clarity and an example. Next slide, please. Descriptive research design. This design, it describes characteristics of a sample or population. This type of research provides detailed information about the demographics, behaviors, and other attributes. It provides insights into demographics and other attributes. I'll also give an example here. Let me also mention here that some experts actually grouped some of the research designs you see here. Some are grouped as descriptive research design. For example, your survey research design, observation research design. I didn't put it here. I'm not talking about it. Oftentimes, I've seen some materials that they are grouped as descriptive research design, while many others belong to the school of thought of which I am, treat them in silos, treat them as different research design with their own unique characteristics. So in case you see a material where you see your survey design as descriptive, please understand that it's also there, it's allowed. However, for any research design that you choose at any point in time, please be able to justify why you are choosing this research method. To a layman, you should be able to tell a 60-year-old woman in the market why you choose this method. If it's clear, simple, you don't need any grammar, you don't need any complex terms, then you are good to go. Next slide, please. Thank you, doctor. And the third research design here is the correlational research design. What does it do? It measures the strength and direction of relationship between variables, negative or positive, without manipulating the outcome, without manipulating any of them. It helps in understanding the strength and direction. Many times we use correlation analysis for this research design. The example I gave here is between physical activity levels and now disease risk. You see, so this is not extending causality. I'm not, in my study objective, I'm not going to say I'm undertaking this study to explain how physical activities leads to heart disease risk or causes the risk, heart disease risk, rather. I'm not saying that. But I'm going to say I'd like to assess the relationship between undertaking physical activity and heart disease risk. So an increase in physical activity could lead to reduced risk of heart disease. That's an hypothesis, right? Either I reject or accept after my analysis. So correlation now, it gives you the direction. You know, you can measure the strength. Strong, 0.00001 or 0.047. That's 0.05 or 0.052, where that's 0.5 is significant, but you cannot compare that to like 0.0001, right? So many of those things also matters. But correlation now, even though it gives you the strength, it does not establish causality. Next slide, please. 4. Please let me say, if you have questions, kindly drop it in the chat box. I would, I'm reading through so that I'll be able to respond. Longitudinal research design, it involves collecting data from the same individuals or groups over an extended period. This is a very, this is widely used, commonly used for large-scale data, but especially if they want to understand or track the sequence and pattern of an event, of a health outcome. So, for example, you want to know the, I don't want to say life outcome. Life outcome is very broad. Okay, let's say I want to know for my generation, I'm in the 40 to 44. Let's say now they want to know maybe the past 10 years or 15 years, then I would like 2025, a lot of things are going on. You know, our own philosophy kind of differs from the 60 to 64 now, or even the 55 to 59. We kind of differ a bit in our ideologies, philosophies when it comes to marriage, raising children, birthing children, and other things, even career-wise. So they want to know career outcomes, number of children, of women born between 1980 to 1995, or between 1975 to 1995, that's 20 years. So then they can provide results, something more concrete, evidence-based data that can actually establish the sequence of events. Remember, in this 75 to 95, we have several generations, like 3 generations. And so they're going to measure our school enrollment, they're going to measure our choice of career, they're going to measure what we're doing, number of children, marriage, mortality, reproductive decisions, healthcare seeking behavior, outcome even of the children, so many things, so many variables, associations could be established, so many patterns could be established in this study. It is called longitudinal. It is not a one-time off. It's not I've collected the data, I read my report. No, they collect the data, is sequential. So different time points at the point of recruitment, maybe the next 5 years, in the next 10 years, and they keep track of each of their respondents. If you read through longitudinal, you can just go to Google Scholar or PubMed and type longitudinal research. You're going to see there are some of the respondents that would travel, that would change location, completely move from North America to Europe. And you know what? They will actually track them. They will call them and they will have an updated record that so Mr. X has now moved to this. They'll keep track over a long period of time. So it's also a very good research, but very expensive. Next slide, please. Kind of complex and expensive. Cross-sectional research design, I think this is the last that I have here. It collects data from a specific population at a single point in time. Ask me anytime, this is the commonest, most preferred, simplest form of research design. Oh, this is a cross-sectional, you would have seen it. This is a cross-sectional study conducted and so. The aim is to explore this and this and this and this. We found the study for our variable is this and this. The study found this, push, finished, published, good journal. It has its own advantages, also disadvantages. However, it is very good. It generates good data, quality data, if you follow the process. Remember, research as a process. It is methodological. It is systematic. So that's the first thing. Please just know, if you are taking anything away, that you should, if you say you want to conduct research, immediately think about, why am I undertaking this research? Okay, how do I answer this question? Okay, why am I using this method to answer this question? Okay, who and who, where and how am I going to, generate my evidence? And what am I even going to do with the evidence? So it is, those steps have to be in place, and you should check each and every one of them. Next slide, please. Thank you. So this is the second path, the B path, the B category of quantitative research design methods. This is where we have experimental. Experimental research design at senior level. I'm trying to use common terms. Advanced, more advanced than the non-experimental. Experimental research design most times explain cause and effect, causality. Remember, non-experimental does not measure causality, it only measures association relationships, while experimental measures causality. A strong example here is your clinical trials, RCTs. So why is this important? It's established causality. Experimental designs, particularly through experiments, here talks about RCTs, are essential for determining cause and effect, relationship between variables. It gives the researcher control over variables. There's something we always call the intervening variables in non-experimental designs. For example, talking about uptake of modern contraceptives among newly wedded couple. So use, availability, can they afford it? Those are many questions I will ask. However, what about the age? However, what are even about maybe the background information, where the woman is coming from, where the man is coming from. So there are so many variables there at play that we have to control for. Some will say control for variables, we call it intervening variables, but for experimental initial design, you have control. You actually, you are in charge, so all those ones, they are out. You can easily say, no, I want all these, I want to check this. Does this cause this? Okay. Does the use of modern contraceptives, postinol, does it cause cervical cancer? Does it increase the risk to breast cancer? That is a different thing. I can't answer that with cross-sectional. I can't answer that with question and answer. I can't answer that with question. I have to not question. I have to establish a causality effect here. So that is a different design in itself, and it's way advanced, very complex, and highly methodological, highly rigorous. Of course, we all understand clinical trials. It goes through so many steps. Aside having your protocol ready, it has to go to different approval stages. Applicability and replicability. Experimental studies can be replicated in diverse settings, and the results can inform evidence-based practices. During the COVID-19 pandemic, we have Pfizer, we have so many vaccines. Before they could say this is approved, clinical trials were carried out. And, experimental research were conducted, and from the findings, they could say, yes, this caused this. This is safe for this is effective, and this is level of effectiveness. And that's how it explains for many of you clinicians, that's how it explains if you take 500 milligrams of paracetamol or Tylenol, it will reduce this body ache, it will reduce your ache, or this will address cold. The dosage. All these are possible through experimental research design, and applicability and replicability is the key thing here that helps us achieve that. Next question. Next slide, please. Thank you. So I'll be speaking on 3 experimental designs. The first one is true experimental design. For the true experimental design, it involves manipulation of an independent variable to observe its effect on a dependent variable while controlling for that variables. Participants are randomly assigned to different groups, your control, and one or more experimental groups. Here we talk more about our RCT, our clinical trials. So it could be double-blinded, it could be single-blinded, double-blinded. When we talk about random assigning, it shows that all the participants have equal chance of being those that be receiving the intervention or those that be receiving the placebo. And double-blinded, that even the researchers do not know who is receiving placebo or who is receiving, the original, and also the respondents themselves do not know which, they are taking. So it is true experimental design. It is taken as a gold standard. It is the top rated, most rated type of research. Like we said, the example testing a new medication effectiveness by comparing outcomes between a group receiving the medication, that's the experimental group, and the group receiving the placebo, that's a control group. Next slide, please. Quasi-experimental design. Quasi-experimental design is similar to true. The only difference is that it lacks random assignments. Now you know the answer to the question I asked. Quasi-experimental design does not assign participants, does not use randomization. So what it does is that it measures causality. between variables. It's compared the effects of independent variable on dependent variable, existing conditions, right? These participants are already going through this. So what is causing it? It's not because I'm just introducing them to an intervention, you know. Sorry, I have something written. I want to pull up my own slide. I have some notes here that I want to that I think I should read here. Just a minute, please. Okay, so for the quasi, there is an intervention. So it's before and after. For example, study the impact of a health intervention, school-based physical activity on children's outcome. So the intervention was introduced. However, we are not saying some children should experience, some should undertake the physical activity, while some should not. No. Everyone is exposed to, you know, health intervention is available to all. And then we want to see the effect of the intervention. Next slide, please. Ex post facto design. This research design method, it studies the effects of an independent variable that is beyond the researcher's control. So it investigates outcome. It investigates outcomes retrospectively when random assignment or manipulation is not feasible. So ex post factor is retrospective in nature. It examines exposures to a protection factor to an intervention in relation to an outcome. So it is not, they're just undertaking the intervention. The intervention or the program had already been implemented. And then, for example, medical insurance. You want to see the long-term effects of exposure to this intervention medical insurance on health outcomes. So I'm going to look at people that have medical insurance. So did the use lead to improved health outcomes or not? So it is, I examine the exposure to the risk or protection factors in relation to the outcome. Next slide, please. Thank you. So the second, remember I mentioned quantitative, qualitative, and mixed methods. So we've talked about quantitative research designs, and we mentioned 5 different types. And like I said, they have so many others, but that are branching out of these ones that I've mentioned. Now, what is qualitative research? Before I delve into this, also remember that I mentioned quantitative and numeric, right? I may not be able to capture experiences with numbers. I may like to know more. I may like to probe. And this is what qualitative does. It helps me to explore meanings. It helps me to gain deep understanding of issues. It even explains health outcomes. It provides more information on why some decisions are made, right? And so when we talk about social determinants of health and cultural beliefs, of course, cultural beliefs, how do you ask that question do you have cultural belief? No, that's not how you ask. So quantitative may not be the best for that. It will not help you to get the information you want to get. Qualitative helps you to address this gap. Next slide, please. So we have examples there, interview, focus group, participant observation, context analysis. These are just different ways of collecting qualitative data. Next slide, please. So why qualitative research in public health? Qualitative research offers essential tools for public health researchers to understand health issues from the local community's perspective. It helps in understanding complex human elements affecting health, illness, and even use of health services. It informs the design and implementation of a more effective and culturally responsive or sensitive health interventions. Qualitative research reduce wastage when it talks to cost. It improves efficiency, promotes efficacy, and also helps the sustainability and even scalability of public health programs. Next slide, please. We're going to talk about 3 commonly used approaches in public health. Grounded theory, phenomenology, ethnography. Next slide, please. Aside these 3, we also have action research, we have case study, we have narrative. However, like I said, these are the commonly used methods. Case study is not what you most likely use, but it is what I'll most likely use. Also being a social scientist. Because it's just, I want to understand an issue and I pick maybe COVID-19. I want to explore experiences of someone, a COVID-19 survivor, you know. So I'll just pick a family, an individual and the family. So I'm going to ask questions, and also the family, how the family behaved during the time, just one person. And I could write my 50-page document article from that. That is case study. But for in medical field, that might not really work, because we need data, we need evidences, that can be used to inform interventions. We can't design intervention based on the experience of one person. So grounded theory, it systematically develops theories grounded in real-world data. It employs a step-by-step approach to data collection and analysis, appealing to researchers from quantitative backgrounds. The aim of this is to move from general descriptions of an issue to generating theories based on the data. So now you want to say, being in this community, observing this, collecting this information, conducting this interview, speaking to different stakeholders, the community leaders, the ballet, and the religious leaders, even the personnel themselves, families, youth. This is the common pattern. This is the thing that is consistent with all of them. Then, can we say that those who experience this will most likely experience it? Then it becomes a theory. And then I begin to look for, how to support that theory, right? Based on the evidence that I've generated. Example here is researcher using grounded theory to examine the complexity of HIV disclosure in vulnerable populations. So, of course, we have a lot of article on HIV, HIV and AIDS, the disclosure, and especially among vulnerable populations. There's so many associations that have been examined. So, you want to step out to say, how do I even explain this association? So let me go to the community and know more. You can adopt grounded theory for this particular exercise. Next slide, please. Phenomenology. This is a research method focused on exploring the common meanings of individuals' lived experiences. It seeks to understand the essence of experiences from the perspective of those who have lived through them. For example, I want to know the use of modern contraceptives among sex workers. So asking a sex worker on use of modern contraceptives, explore their perspectives, might be different from asking a high school student on the use of modern contraceptives. So a sex worker, I might not ask, do you not use? I may come with more, tell me about your experience with using modern contraceptives. Why did you even use it in the first place? Oh, what happened when you did not use it? Was there any time you chose not to use it, even though you know the risk? Why? You see, so I'm addressing that question. I'm asking my questions from our experiences, from sharing our experience with me. And from that, I don't need many, 10, 12. It's enough to generate large data that I could use to say, this is what causes this. Not causes, this is what extends this association. An example here is examining the experience of patients living with COVID-19 after hospitalization to understand their lived experiences and attitudes towards health. Do you use mask? Do you now wash your hand? So what's your experience? What's your perspective on hand wash, on washing of hands immediately you come in from outside? If you ask me, oh yes, I was exposed to COVID, I think 2 times, and I had all my vaccines. I completed my dose. Even then, my daughter was like 7. I made sure that she also completed her dose. That was appropriate for her age. Because I was infected and I knew what it was. For like 2 weeks, we were all grounded in the house. I couldn't eat. I was crying for one. I myself was sick. They were giving me food put on the door. So I lived through it. So the way I will answer that question, and even my attitude toward health, my health-seeking behavior now, what I do, how I care for my family when I hear of COVID is out now, the things I immediately put in place might be different, will most likely be different from someone that was hearing, COVID-19 was that side. Nah, lie. Now just so Igbo disease. I don't believe it. You have read Psalm 1. It's Psalm 90. I believe it. However, I'm saying that our experiences differs. And that was to inform, what I share. And that could become very useful for to understand health behavior, to understand some issues. For example, obesity. Smokers die young, but they are still smoking. Smokers die young. This experience you, but they still can't stop. Obesity, you are the risk of high blood pressure, at risk of anything, but they will still eat. What are the things that could be the reason for that? So maybe there's an experience. So phenomenology is commonly used, and it is a very good research design. Next slide, please. Ethnography. This is an immersive observation of a community or setting to understand cultural and social dynamics. It relies heavily on participant observation. I once met someone, I think in South Africa, then that traveled to Igbora. There's a community in Oyo State where they had, I think in the world, they have the highest recorded multiple births, 2, 3. I was there one time to collect data. I can't remember why, but I could confirm that every house, in fact, they don't call Kehinde in that place. They don't call Taiwo because everybody's going to come out. The person talking to you is Taiwo. The person standing next to us is Taiwo. Everybody. So I remember that I met a researcher that traveled from Vids. She lived in that community for 6 months. She wants to understand, what do they eat? Is it water? What? This is beyond biological. This is beyond some chromosomes. No, this is something else is going on in this community. So, and that asking question focus group may not answer. She lived in that community for 6 months. There are also studies that I've read where people lived in communities for more than a year, 2 years. There's a study on coal miners. The man lived there for 3 years. First, he had to go there to first be like he's looking for a job. He's, started, he asked no one. He lived there. He also went to the mine he understood. He was, that is immersing yourself. You are wondering, do people go this far? Yes, people go this far for studies. And people collect great data, generate evidence from these research designs. Next slide, please. This might be small, but please at your leisure go through. I just provided brief distinction between quantitative and qualitative research designs. And general framework, I've talked on that. Analytical objectives, I've provided some context on that also. Question format, close-ended, open-ended. Open-ended will allow you to probe, and while close-ended is straight to the answer. Data format, numerical, textual, flexibility in study design. For quantitative, your study design is stable from beginning to end. But for qualitative, you could go back to say, when I was asking that question, I noticed that they were not comfortable. Let me reword it. But I would not do that to, oh, thank you. Prof just mentioned my friend studied the Idumota drug market by living in and out of Nigeria for 10 years. Yeah, thank you, Prof. So that was just talking about the ethnography. Actually, I was at a place where they were talking about research what people do, and I'm thinking, when they are mentioning researchers, Mary, don't mention yourself. Don't even lift up your hand. People spend a lot. If people go through a lot. I was opportune to lead a study here on the experiences of immigrants in Canada. We define immigrants as those that arrived within the past 5 years, and we're asking questions about health outcomes, uptake of health services for their children, use of child care leave services for children, education services, because here they talk about, oh, we are not biased, Canada is open. Oops. It's just that US announces their own. Oh, Canada is silent, but it is as crazy, if I can use that word. In fact, more than America. Silent. They wouldn't talk. But you call someone, they'll tell you, I can't hear you. That's very common. I can't hear you. I'm speaking English. Sorry, could you speak clearer? I can't hear you. Or you go to the system, they tell you to wait. Many of us have heard of a doctor that died because a doctor, he waited for hours in Image and he wouldn't attend, you know. But if another person comes, I tell you, another white person comes in, they'll tell you, this is an emergency. Please, would like to quickly see this person. Can you just wait? The doctor will soon be here. And you're there. I've had to take my children out before. I was angry. But they called me back. Sorry, you have to come back. And I went back. So this kind of study is not yes or no. At times, you need to be in the community and living to answer it. But people go far to generate quality evidence. My dearest colleagues, people put in a lot. Everything is checked on the list. The point, and I'm sure why Prof is doing this and why she's undertaking this and why many of us are here, I'm also learning, is that gone are the days where you can cook up data, gone are the days where you can just collect the data just for publication. No, it is beyond publication. It is beyond adding to body of knowledge. It is this knowledge you are generating. Can we say is reliable? Can we send it to WHO today? When they are conducting systematic reviews, can they use your work? Anytime I receive notification that somebody started my work and it is systematic review, they started my work, you can't understand how I always feel. It has happened many times. I feel, yes, because for you to write systematic review and cite a work, especially top-rated ones, it is a good work. I'm not saying that's not the work I have. There are so many that I've even removed from my resume. However, we are learning, we are improving, we are advancing. Thank you. So please take note of that. Next slide, please. This is going to be very fast. Why? Because of what I've seen on the screen. Your MIS method is your qual plus quant, qualitative plus quantitative. Qualitative methods, techniques such as interviews, focus groups, textual analysis are explore. Remember one of the questions I asked, I said quantitative explores phenomena and qualitative, I think examines, I put something in a phenomena, something, it is wrong. The answer is no. Quanti does not explore phenomena. It is qualitative that explores phenomena, while quantitative only tests hypothesis in a structured way. So when we are doing it again, now you know the answer. Next slide, please. Benefits of mixed method research design. Why do I think mixed methods would be best to answer this question? I mentioned that I led a research. Actually, this study was funded by Public Health Agency of Canada. And we're actually scaling it up now. They've asked us to provide so after the work, another organization used our data as a case study in itself, and they're writing the report now, so they'll share it with me to read through of what we found using our organization as a case study. And the work actually was first written to be discussions, table, just roundtable discussion. And I felt, no. So when we bring 10 women together to talk about their experiences with using healthcare services, we have a system in Canada. In Nigeria, if I want to see my doctor, actually, I may not even get to the hospital. I just call, hey, babe, where you dey? They are waiting. I beg you, they what? Sorry, apply to those that don't understand. Are you in the hospital? Yes, what's it? Yesterday, my back, I can't stand up. Go and use this. Or come, let me examine you. I'll just pack. Go in. Here, there is nothing like that. You have to call. Hi, doctor. In fact, it's the secretary that pick. Can appointment I like to doctor? They'll tell you, okay, please, if it's an emergency, then they'll read something for 5 minutes. And you're like, if an emergency, please go to the emergency ward. Do you have code? No. Do you travel to Canada? They're still asking that question. No. Are you been for the past 6 months? Yes. No. Many questions. Okay. I'm sorry the doctor is not available until just a minute. Just a minute. I'll be right back. Just a minute. I'm sorry, the doctor is fully booked for the next 2 weeks. But if you can come back in September 10th, I would gladly hello, September what? No, cancelled. The fact is that no one else is going to take you because that's your family doctor. You can't be angry to say, I need to go and see another doctor. No, because all the doctors, they will tell you no accepting new patients. They have their patients. You can't just go in. So you go to emergency. Emergency will check you 1 second. Maybe you've heard the phrases that what Tylenol, that's paracetamol, and Advil, like Panadol, cannot do in Canada, does not exist. If you have flu, cold, your head, backache, tummy ache, breast pain, anything, Tylenol, they will refer you back to your doctor. So the system is such that I can't bring 10 people. So I have to think and say, you know what, how much do we have for this project? Okay, can I make you miss my thoughts? And I got the approval. So we designed a questionnaire. And then I had to go and defend before the Public Health Ethics of Canada on why I want to bring people together for interview, because it's for ethical reasons. And then I have to go again and sit. If I faced a lot of, I think I briefed my prof then, was serious, 12-man panel, how I'm going to deal with people when they're reliving their experiences. And I'm like, I will ask them, they said no. When someone has, like a woman lost a child due to systemic failure, you get to bring back the memory. What do you have in place? I kept thinking, oh, that's true. I never thought of that. We have to reach out to counseling units. We have to reach out to social units of something Canada for therapy, have them available, get some numbers, for just this study. But Miss Methods could provide me the information that I think could cause a change in policy that supports new immigrants. And thankfully, we're on that process, right? We've generated the data. So what am I saying? Miss Methods helps you to address issues beyond just a flat scale, beyond just collecting data. If you want to advance or you want to go into advocacy, cause a significant change or design a net intervention, holistically, Miss Methods becomes your best tool. It doesn't mean it will always be, but most times it becomes the best because from all angles, you have the information. From quantitative, qualitative experiences, how do you think? Perspectives, numbers, you have the information to make an informed decision that would help, that your constituents could say, yes, we have this study. This is what it says. Let's look, please set up a committee to look into this. The fact that they want to set up a committee on that shows that your work, to an extent, is reliable. So that is just a brief background. Mixed methods suitable for research questions that require thorough understanding that cannot be achieved with only one method. It is also beneficial for triangulation. Triangulation, we did a study among early childhood education. Sorry, my children are just waking up. Early childhood education in 4 African countries. So what is situational analysis? What is the current situation, right? So we did like a SWOT analysis to identify the trends. What's the current system in place in Nigeria, in Kenya, in Namibia? We have those countries. So the first thing we did was scoping review, not systematic review, scoping review. So not just that, we went through great literatures, documents, office documents, we went to UNICEF, we went to so many across all the countries, did that. That's 1. 2, we then develop the questionnaire from the findings of the review. In fact, they published that. Then we developed a set of questions. Went to the field, did analysis. From that, now developed questions to guide the focus group discussion and interviews. We did interview for policymakers, the State Minister for State of Education in Nigeria, the SUPEBs, the Education Board, many of them across 8 states in Nigeria. Also, they did the same in Kenya, stakeholders, universities, lecturers, dons in education, in early childhood education, were interviewed. We did also focus group with teachers in rural, teachers in urban, their thoughts, perspectives on inclusivity, children living with disability. You see, so this is triangulation. 3 different sources of information were matched. Why? To have a more in-depth understanding of that particular issue. That is one of the most outstanding benefits of mixed methods research design. Next slide, please. Types of mixed method design. We have convergent designs. We have explanatory sequential design. We have exploratory. Convergent design talks about quality and quantity research taking place at the same time. So in the morning, we distributed questionnaires. Then as you're asking the question, I'm asking, oh, doc, please, are you available between 11 and 1 p.m.? Oh, why? Please, we just want to ask some medical doctors, some few questions. It won't take time. It won't take time just to ask 1 or 2 questions, just to know your opinion on current medical system or current something or current use of a particular issue, or, So, oh, you know what? No, I'm going on 1 round. Available by 1 o'clock. Okay, 1:30 will do. Right there from questionnaire, from the survey, I'm having them together to sit for the focus group discussion, or I even want to go into the office, of the head director to interview at the same time. Why explanatory is quantity first, and then followed by qualitative. The example of what the study I told you that we undertaking here is quantity first and then qualitative. Why exploratory, you just switch, is quality first. So you've asked questions. People have told you, I don't like using modern contraceptives because my husband said that, they sweet. Oh, okay. Please, could you tell me you know the sweet? My husband said it makes him uncomfortable to use condoms, so I don't use it. My husband's happiness is the key. The Bible says you see, in the few things I've mentioned, I brought in 3 different things. The Bible says religious view. 2, my husband says authority, right? So then I'm talking about the social dynamics in the household. Then 3, I'm talking about, he said, he doesn't enjoy it. Is it he? Then I'll probe. Is he your husband or you? So you see, then once I have all that, maybe I have focus group, again, many of them are saying the same thing, then I can go back and put in my question, use of, I could say knowledge or uptake, use of modern contraceptives. Then I have a question, do you know modern contraceptives? Yes or no? Which method do you use? Which method do you know? Yes, this and this. Then which method have you used before? In the past 3 months, or how often have you used this? Okay, What are the common reasons why you have not used it? Then I'll list husband does not approve, others does not enjoy sex. It makes uncomfortable. You'll be wondering, where did they get all these options from? Others, the options I'm providing my questionnaires, right, emerged from the findings of my qualitative study. I hope it's clear. Next slide, please. There are key ethical considerations for mixed method research: confidentiality and informed consent. Ensure confidentiality and secure informed consent across different data types with varying sensitivity levels. Confidentiality and informed consent for mixed method for quantity is different from qualitative research. When I did some study back home, I think, thank God, thankfully, I've also been opportune to lead some, to write some, and to be part of some research. Once we get approval, I submit my protocol, right? I submit my protocol. This is the study, the aim, the objectives. I'll submit with the questionnaire for the my questionnaire. I'll also submit the FGD guide. I get my approval. But here, no. I first have to go and face a panel, develop a different flyer, recruitment flyer for the quantitative. That's for the survey, because it's a community survey. After getting approval of that, after conducting that, I now have to go again and develop the flyer to recruit the quali. And I'm like, but these people like stress, yeah. But it's the same. I'm not bringing new set of people. My quali, those I'm using for the qualitative research are from, but no. They said, in fact, they gave me one long document, like 3-page. They differ. And I found that true, yes, going through it, confidentiality in quantitative research, your questionnaire is just me. It's anonymized. I have it. You don't even need to put your name, right? But for qualitative, I put them together, except for interview. So there is a need to first let all my participants of the FGD know, please, everything we say here stays here. Please, importantly, don't share what you would not like to hear outside, because I could say everything we say yesterday, and somebody could go out and say, ha, Dr. Rachel, something is happening in this Ife. Who are you? Hey, when we did interview today, those Oyinbo that came from US, that they gave you $50. Yes, I was there. If you hear what Dr. Mary was saying, well, she said it's her friend that aborted 4 times, so, but it's not. She's the one. She's the one. And then when they are now talking, she now started crying. You could see her eyes are red. Ridiculous. So we have to keep saying, please, whatever you are sure you cannot share, don't share. I was saying this as it became every time I ask a question, I'll say it, because I was trained. Like I said, I had to go and face a panel to understand, please, confidentiality of quality differs completely from confidentiality of quantity. Then informed consent is different. They signed form for informed consent one, they signed informed consent for the second one. And make conflicting findings. There are times that what you found is completely different from what you expected to find. The pattern or going through your teams, you are finding different, different meaning. Like, whoa, I didn't see this coming. As a researcher, please don't influence, don't manipulate your data to speak your language. Don't. Just say what you find. If you cannot find association, well, the study in Kenya, in Lagos, in Nigeria, in Brazil found this. However, our studies showed this and this and this. This could be explainable due to this and this and this and this. If they get back and say what they found is different from what the study is saying, well, that's why it's a study. Someone else again should go and investigate further. That provides the basis for the next research. Respect and integrity. Please maintain respect for participants. Let your participants have the right to pull out of the research at any point in time. our SARS, we are giving $50 Walmart card. We provide free lunch, we provide free transportation, that's provide Presto card, that is Presto card. We have a card where you just tap, train, or whatever, yeah. So they said, after giving someone all this, and the person pull out, what do you do? I said, nothing. People pull out at the last phase of clinical trial, even after they've even, some have even received, the real experiment and it's been found to be effective. Some have collected big money. There are some study clinical trials that they give you big, money, and they pull out. So respect your participants and uphold their rights. Thank you. Next slide. We're wrapping up. I think next slide is my question. Thank you. Next slide, please. Okay. So please, I would like us to, we have 15 minutes to do this. Actually, we have 10 minutes. I'd like us to go into groups, with just 3 groups, and this is what we're supposed to do. Select a public health issue, pick anyone that is not too complex. I just want us to just critically think through some of those things. Once you understand, you can explain this, it stays. And some of the things I'm seeing now are things that I've been exposed to over the past 15, 16 years of my life. And I'm still learning more. So, but I found that at every point in time, it is, if you do the assignment, I'll write and send to you. Maybe you already have a research you've done, just cut and paste for me, it's fine, I wouldn't know. But when you are together, you just immediately you could figure out the topic, clearly have your aim, clearly have a research question, and think through, this is what we should use. No, this is why we should use this. I tell you, it's been found to be highly beneficial. So please put everyone in 3 groups, and then let them quickly address that. And then we'll be back here by 10:48. Sorry, my time, 3:48 p.m. I'm not joining a breakout room. Well, I've also joined. It's so kudos. I hope everyone is ready in their room.
Yes, I think so. There's room 2. Room 2, we're missing 2 people, and room 3, we're missing 1 person.
Okay, so you want me to join one, right?
Well, in my
I'm not
guide,
going to say
yeah.
anything if I'm there. Well, I could join. So whatever you want me to do.
Yeah, I think you could just join and observe.
Okay, thank you. So which one do you want me to join here?
Any would do.
Okay, let me join. Okay. Doc, I said we are here alone. Hello?
So I'm jumping into each of the rooms. Just
Okay. Can we
Hello?
have people back, please?
Oh, okay. I was going to ask how much time, please.
Yes, please. Let's have people back. Just give them 1 more minute, please. Let everybody come
Let
back.
me just go.
Can we do just 10 minutes more? Will it be possible, Dr. Kudus?
Let me go to the rooms. Let me get them back.
No, don't give them like after so that people can give back. And can we go like 10 more minutes? Like,
Okay.
what? Okay, thank you. Let everybody come back, please. Thank you.
Yeah, all the rooms are. Yeah, I'm muted.
Welcome. Yeah, welcome back. Welcome back. So we're gonna have someone just for 3 minutes speak for each group. Room 1 should start now. 3 to 4 minutes, please, Max. Room 1.
Room one, anyone in room one. Just tell us what to discuss.
Good afternoon. Good day. Can you hear me? Can you hear me?
Yes.
Yes.
Loud and clear.
All right. So for the aim of our study, the aim of the study was that eclampsia, preeclampsia in teenage pregnancy. And going by the research question, we aim to study the prevalence of eclampsia in teenage pregnancy among adolescents in Ibadan. And we are using for the study design, it's going to be a cross-sectional study. Reason being that
Go ahead.
Madam,
The last two, Emmanuel.
any other person? Madam, madam, you can't say.
oh, please, can you hear me now?
Yes.
Yes, okay.
Okay,
Stop at the reason.
okay. I said for the design study is going to be a cross-sectional study. And the reason being that we are just collecting a data across the sample population in Ibadan for a specific period of time. So that'll be it from my end. Thank you, ma'am.
Okay. Thank you. So you said a specific period of time. What do you mean by that?
like just for that at that particular point for that particular study population, we aim to collect data regarding the prevalence of preeclampsia in that particular population at a particular time. So going by that the quantitative data, we can deduce how prevalent eclampsia and preeclampsia is in that particular study population.
Okay, so what you want to know is just the prevalence, not
Yes, ma'am.
associated factors, not
Mm,
risk factors, not. You are not exploring that.
No, just the prevalence, ma'am.
Okay, awesome. So that's what we are saying. Clear question, clear objective, clear the sign. But if you are decided, we also want to know associated factors. We'd like to know what other background factors could, increase the risks, to teenage adolescent girls experiencing eclampsia, right? Is it preeclampsia or eclampsia? Whichever one. Then you may want to include household factors, where they are living, caregiver, because you're talking of teenage adolescent, right? Caregivers, what role do they play? Studies have shown. So then maybe they cannot even make their own decision. Maybe it's a situation of an adolescent girl marrying another person. So she cannot make a decision. Then you want to talk to her husband, you want to talk to her caregiver, then it becomes quality inclusive, right? So I like your work, it's clear, and then your design too is clear. You know why you want to do this, you know what you want to do, and that's it. Thank you for sharing with us. Mr. Dr. Owo Emmanuel Kennedy.
Well, thank you very much, ma'am.
Yeah. Thank you. Someone from room 2, please, over to you. Yes. Go ahead, Akinyosho, please. You are breaking. You are breaking. We can't hear you.
So can you hear me?
Yes.
Okay.
Please speak loud again.
So we were trying to look at to assess the predictors of substance misuse amongst adolescents in Osun West local government area. Can you hear me?
Yes, please.
All right. So the research question was, what are the predictors of substance misuse among adolescents in Osun West local government area? So even though that seems very broad, since we do not have specific predictors yet, but we were trying to adopt possible predictors that have been studied, like previous studies, then apply them to this study population and see what kind of information we're going to get. And then we plan to adopt a mixed methodology study, because a quantitative study design alone might not give us all of the information we need. Because, for example, picking parental negligence as a predictor for substance abuse, for example, a participant might not really give you all of the information you want through a quantitative study data. So having a conversation like a key informant interview, focus group discussion, might assuring them of their confidentiality, might be able to get us more information. And then even during the study, we might also be able to find out certain predictors that we did not even set out to get from the start, and to help us ask further questions in subsequent studies. So that's
awesome. Awesome.
Thank you,
Thank you so much. Thank you for sharing that with us. I love the way you provided the information on why you adopted this particular research design. You mentioned something that is critical. It's obviously you starting from the place of the literature. So like I said, in your research process, please don't skip any step. Please, you can go online and just type 12 research process. You see, you're starting from literature, so that informs your question. Of course, you know what you want to study, but then you want to know what is actually out there. Do I want to, do I want to start anew, or I could just adopt, or adapt the questionnaire? And then, however, I should also be open to learning new things. I don't want to go with a closed mind. Let's make it mixed methods. Why mixed methods? This study said that parental negligence, I can't capture parental negligence from, numerically, then let me ask qualitative. So if I'm doing qualitative, I'm doing quantitative, then it's mixed methods. Right. And there are many other things that will now begin to come into play. However, this is the basic. Having a clear understanding of your research aim would guide you to know the design to adopt. And that would also, so when you're doing my question, my design, you should also flip it to say, can this design answer this question? It should be equal to each other. This could answer this. This should be able to, provide me the information that I need. And once you have that, you are good to go. Thank you so much for sharing that with us. Akin Osoye Grace Ogenetega. Someone from room 3, please.
Yes, good day, ma. I'll be presenting room 3.
Go ahead.
Okay, yes, the public health issue that we concluded on was cervical cancer in women of childbearing age. And our aim for the study is to study the impact of HPV vaccine uptake on the incidence of cervical cancer. And our research question was our question was, what is the impact of HPV vaccine uptake on the incidence of cervical cancer in women of childbearing age in Southwest Nigeria specifically? Then the study design that we opted for was the longitudinal study design. And our rationale behind choosing this study design was to be able to observe the participants over a long period of time, because cervical cancer is something that's, for you to understand, you have to study looking at these factors and observing your population over that period of time. So I think the longitudinal study was what we choose, and that is probably the main reason why we choose it. Yes.
Thank you so much, Joshua. I like that. I was waiting for you to just tell me the research design you are going to use. And I love the fact that it's longitudinal, because you'll be collecting data at different, sequentially at different time points. Not just that, because it's longitudinal, please know that longitudinal most times is both, because they are tracking. So you collect information, all information related, and also outside. You're also going to ask questions on hygiene, their dental health care. You get to ask questions on their income level. Maybe they could not answer. You get to ask questions on the partner. The person was married before, but now not married again, so that I can understand the exposure, the different exposures, and the different factors that interplay. What of the event, the environment where the person is staying, the community, women that live in low and resource neighborhoods, maybe they have limited access to healthcare facility where they could have access, to the HPV vaccine. So thank you so much for having clear understanding on what you want to do. It's all about knowing what you want to do, being clear, and then having the justification for your study design. Thank you, Prof.
Yeah, thank you very much. I just wanted to, thanks for the excellent teaching, and I myself sitting down here to learn. I think I wanted to raise for the last one a major word that we often use. If you're not conscious of it, we use it just flippantly, but it definitely has an impact on the study design. And that's when you use the word incidence. You can never generate any incidence in a cross-sectional study. It has to be a longitudinal study. And whatever design for the longitudinal study may be appropriate and tell you something. But once you use incidence says you're looking for new cases. So you're going to have to study people from when there was no case and follow them up until you have cases. When you say prevalence, it's always a cross-sectional study. You want to know the people that have the diseases at the point in time. So I think those are critical things that the words in your aim also starts to direct you on what this means in terms of design. Once again, thank you very much. Over.
Thank you, Prof. Thank you so much. Thank you. Dr. Kudus.
Thank you.
We can hear you, please.
I think you're using a earpiece. We've not been hearing you since. So.
Yeah. Oh, sorry about that. I think my earpiece is functional, but it should be better now.
Yes.
Okay. So I just want to support the research topic of room 3. There's actually a publication last year or 2 years ago that is exactly the research question they brought up, which is impact of HPV vaccination on cervical cancer incidence in Sweden. So it's a good one. Thanks, and over.
Thank you. Thank you so much. Everyone, I am so glad that we have been here together for the past 2 hours. I don't plan to to delay you longer. We're just going to have a recap now, and then we'll quickly go through our quiz again. Now everyone should have 100. So let's have a recap. The last slide, please. Next slide. Thank you, Doc. Thank you. As mentioned, please note the following. Research designs are crucial for generating valid, reliable, and generalizable evidence, serving as a foundation for effective scientific inquiry and evidence-based health interventions. Your types of research design matters. Clearly differentiate between quantitative, qualitative, and mixed method research designs. Ensure that it aligns with research questions and methodologies. And one thing again that Prof just mentioned, your choice of words could also direct you to knowing what you should use, right? The method that you should adopt. Quantitative research designs includes non-experimental and experimental. We've talked about that. Non-experimental research designs focus on observing, analyzing variables as they naturally occur in their natural settings without any form of manipulation. Next slide, please. Experimental research design, you learn how experimental designs establish causality by manipulating variables and controlling all other extraneous factors. Qualitative research design explores qualitative methods that interpret individuals' experiences and social phenomena, providing rich contextual insights. Mixed method research design combine quantitative and qualitative approaches to address complex research questions with comprehensive insights. Methodological approaches to qualitative research familiarize yourself with grounded theory, phenomenology, and ethnography. It goes beyond just conducting focus group. It goes beyond conducting interview. Which design are you using? And then all this you need to generate and also design culturally responsive health interventions. Thank you so much. Next slide. I'm sure it's my thank you. Yeah, so we have other resources, YouTubes that I just put some of those things out from my database, but the YouTube is good. Please just go through it, spend less time. I know many of us are not, maybe the Gen Zs, I just reduce the time on social media, go to YouTube and learn. I tell you that a lot of resources have there, a lot of textbooks out there for us to use. So before we go, the next few minutes, please let's go back to our Slido and do our quiz again. If you are in, just type in, and then that should take us less than 3 minutes now, and then we are good to go. Let me know when you are in. Put in the chat in, so that I can make it live. Okay. So we're starting again. Question 1 is live. Okay. I want to go to question 2 now. Question 2 is life. I'm going to question 3.
If I may ask, I'm not seeing questions, I'm seeing answers. Is that the same for everybody?
Oh. Oh. Oh, someone is asking for the code.
So you're moving, we're seeing it, but what we're seeing is the answers of, so we can't vote, we're just seeing the answers, I think, from the previous one, and it says the correct one, yes. So we're
okay.
not seeing questions to vote.
Okay. Okay. Let me do something. Just a minute, please. Okay, I'm almost through. Okay, I think because it's a free one, they are not okay, I've seen it. I can't share it again. Now I have to pay an upgrade. But I think it's fine. The message is clear. We've learned new things. I don't want to, there's no need to keep us waiting again on that. But I could post I don't want to be putting the questions in the chat box so it doesn't keep us again. I hope that I've been able to provide enough information for you to use and to guide you as you journey in your research career. Questions, and then we can bring the session to an end.
Yeah, thank you. Thank you very much, Dr. Mary. I think it has been 2 hours well spent. I've learned a lot from this session, and I'm sure the fellows have also learned. Now we'll take questions. Please be straight to the point, and our time is far spent. Christabel.
Thank you very much, sir. Good afternoon, sir. Good afternoon, ma. Good afternoon, everyone. I just want to clarify when we were talking about I think it was quantitative research, and then you mentioned the thing about p-value and measuring the strength of the strength of the relationship. So you made some mention about the fact that if the p-value was 0.001, it had more there was more relationship, or it was more significant than if the p-value was closer to 0.05. I wanted to confirm if that's what you meant, because I don't think I know it to be that way. I just know that once it's significant, and the values didn't really show the strength of the significance.
So I think we should first understand the context. I remember I was talking about when someone tells me that I was talking about research process. I said, if someone skips and start talking about analysis and saying I want to collect data and I want to use p-square and my p-value is this, that first I'm thinking, what led to that? Why y chi-square, rather, y chi-square, then why this p-value of maybe is p or p is defined as p is 0.05 or 0.001. So I mentioned that. And again, when we are talking of p value 0.05, 0.001, it depends on the study. There are some studies that for cross-sectional, yes, like I said, there's some studies in random RCT that the p-value matters a lot, right? Even in systematic review, we are doing some systematic review and we are trying to do the meta-analysis, right? The p-value, it matters a lot. But like I said, of course it's significant, but when you get to some levels, your p-value, I'm part of a study now. We are looking at use of some AI tools, devices in addressing chronic back pain, right? So we have extracted, we're at the level of doing meta-analysis. You don't need all the mean value, you just need your standard deviation, the p-value to generate so many other things. At this point, the p-value matters, whether it's 0.005, 0.05, or 0.001. You see, so those are things that I don't think you should really. The key message is not skipping the research steps. Ensure that you check everything you should step by step, is sound methods, and then when you get to Prof, when you decide to do the analysis from your design, you will most likely know the one, the p-value you want to use or the method of analysis you want to adopt. Yes, Prof.
Yes, thank you very much, Dr. Opinion. Just to add, I think she's asked a very important question because based on my experience working with people in the biomedical, they will do analysis and then they will report and say P is less than 0.05, as if that is what matters in their statistical analysis. Just to mention 2 points, yes, your p-value, just as Dr. Opinion says, matters. It tells us the strength of evidence of the association. So somebody that generates a p-value of 0.04 and somebody that gets a p-value of 0.0001, it's not the same strength of association. But then there's a lot to it. And the most important of all the lots to it is something called the confidence interval. So you can get 0.001, which is the beginning for me to even look at if it's interesting, but I would definitely go to the statistical, the confidence interval. And this is beyond this, but one will want to look at how wide the confidence interval is. So the wider the confidence interval, the less dependable the results. The wider the confidence interval, so it's not the p-value is the first thing that makes you get interested. But you get the p-value, okay, you look at the confidence interval. If the confidence interval is wide, you know that this has a problem. And what is the problem? Whoever is a very good researcher will look, it's likely your sample size is inadequate or your study is not powered. So it starts to tell a lot of stories. So it's not enough for you when you do your project and say, oh, P is less than 0.05. No, you must quote exactly what it is. A P 0.023 is different from a P 0.001. It is not the same as equals less than 0.05. You must get that clear. And I
Thank
think
you
for me,
very
that's
much.
the message. Yes.
And
All right.
Prof,
Thank you. Over.
just to add, and that is why when you are looking at articles published, when you write the p-value, we'll always have the confidence interval in brackets. Immediately, you have to state the confidence interval so that it can be measured. Thank you, Prof. Thank you so much, ma'am.
Thank you, Prof. Thank you, Dr.
You're
Bia.
welcome.
I guess that's the last question. Any other person with question?
Okay.
All
Thank
right.
you. Thank you, everyone. Thank you so much for.
Thank you
ma'am, once
so
again.
much.
Thank you.
Thank you. All right. So, very quickly, we'll go to in-house. Sorry, I need to end the recording.
Okay, I think at this point I can.
Yes, thank
Okay.
you.
Thank you,
Thank
everyone.
you.
Bye.
Okay.
Enjoy the rest of your day.
Okay.
Cheers.
Bye, and thank you.
All right.
Bye.
Yes.
Prof, I think you are now the host. Yes, you are the host. Mike, I can end the recording. Prof?
I hear you. I'm trying to,
Okay. All right.
don't know how I do that. End recording. Where do I end recording? Okay,
Okay.
let me see.
Record.
Okay.